Impact of cost of living crisis on the community. Healthwatch Leads Check-in at the Living Well York Road Marketplace event. How has the cost of living crisis impacted on people's lives?
Currently, the cost of living is causing a lot of problems in the local area, and we're seeing a dramatic increase in the number of members that come to us for support around bills, particularly utility bills. We have heard stories about people choosing whether they're heating or eating, which is really difficult. At the moment, the sun is shining, so that will be less of a problem. But as the year goes on and the winter nights come in and things get colder, this is going to be becoming more difficult for people as well.
We've had a lot of people panicking about how they're going to afford to pay for things with everything rising in costs. I mean, you go in the supermarket every week and there's prices going up. People are getting bigger electric bills. There's a lot of panic going on out there.
We're seeing the cost of living crisis affecting those people because they're having to make decisions between buying alcohol, which they need to essentially stay alive, and paying their rent or buying food or buying necessities for their children.
We found that many people struggle to warm their homes during the winter months, and they also struggle to provide enough fuel for their homes.
The cost of living crisis is a huge worry to an awful lot of carers about how they're going to manage. A lot of caring involves people perhaps using taxis to get from A to B because the person they care for can't manage on public transport. With certain conditions, people with care needs need to live in an environment that perhaps is very warm, so they have, and particularly obviously over the winter, people very worried about having the heating on, having enough warm clothes to wear.
What support can your organisation provide to people impacted by crisis?
At BSA, we're looking at a number of different support initiatives to bring in throughout the year as it goes on. In particular, we will be doing a winter wellbeing roadshow where we're going to go out to different points in the area. We're also going to be setting up an emergency food hub for people that have difficulty purchasing shopping or just need some essentials in there, some long life products. And we're also starting a project working with the NHS called Enhance, where we're going to be working with individuals that are at risk of hospitalisation.
One thing we've been helping with as well is digital stuff like devices, helping people get phones. So we've got some donated phones, and I got some funding as well to be able to help people to get a tablet, for example, which we've done like on loan, or we've gifted phones as well. But I've managed to get some data and some calls and text donated as well. So we've been giving those out to people, which has helped them obviously save money elsewhere, so they don't have to be paying out those bills.
We can help people by offering them detox, so getting the alcohol out of their body. We can help them by referring to other services in Leeds.
Try to do is expand on our Home Plus services by providing, we have the funding for the Fuel Poverty Scheme, which we're now rolling out, which provides clients with, if they are eligible for the Home Plus, and they need it, we also provide appliances to be delivered to their homes. We really want to focus on people being able to operate and manage in their homes.
Carers Leeds offers a range of different support to people, the opportunity to talk one-to-one about your situation. We run lots of support groups across the city, some online, some face-to-face. We do have a Time for Carers grant to support carers to have a break from caring. We can often act as a go-between, perhaps between health and social care services where people perhaps don't understand, and sometimes the opportunity just to meet up with other carers in a similar situation. And it's just so important that we keep carers fit and healthy, and making sure that those people with care needs can remain at home for as long as they can.
Thanks to Tom Armstrong, Burmantofts Senior Action, Donna Weldron, Richmond Hill Elderly Action, Isabell Greer, Forward Leeds, Anna Kedge, Care and Repair, Sean Cartwright, Carers Leeds, produced by Healthwatch Leads in collaboration with Chu Yu Cho.